So this upcoming panel is one that I'm very, very excited about. The Persons with Lived Experience panel will be moderated by Dr. Lenora Higginbotham. Dr. Higginbotham is a neurologist and an assistant professor of neurology in the Movement Disorders Division at Emory University School of Medicine. And we're also very, very pleased to welcome our panelists, Christine Buss, Karen Hayes, and Claire Pensyl, who will be discussing their experiences as caregivers and their participation in research. Thank you so much for joining us, and thank you, Dr. Higginbotham. I'll give you the stage.
All right. Well, thanks for that introduction, and I'm really excited to be moderating what I'm sure will be a really excellent panel from 3 amazing caregivers. And I'm basically just going to jump right in and start with introductions. And then I'll introduce each one of you. And then you can have a chance to just say a few words, extra words about yourself as we go through these. So first, I'm excited to introduce Christy Buss, who I've actually had the pleasure of knowing for several years now. She's the daughter and caregiver of to her father, Robert Buss, who I actually started following in my own clinic in 2019 for dementia with Lewy bodies. And just over the years, I've really watched Christy's remarkable dedication and advocacy for her father's journey throughout this really difficult process. And she and her father have been involved in various research studies at Emory, for which we are extremely grateful. So maybe Christy, could I ask you to just take a minute and say a few more words about yourself, maybe your background, or whatever aspects you think have been important on your caregiver journey.
Thank you, Dr. Higginbotham, for those nice words. It's been great to know Dr. Higginbotham. This journey is difficult. And I'm here to help the medical profession learn more and, try to understand it and make this disease much easier for my father as much as possible.
Very good. Thank you, Christy. And it's great to know you too, obviously. And now I have the pleasure of introducing Karen Hayes, and who was very warmly nominated for this panel by Sarah Payne of VA Puget Sound Healthcare. And Karen served as a highly dedicated and motivated caregiver to her husband, Scott, who lived with dementia with Lewy bodies for many years prior to his passing earlier this year. And as I understand, both Karen and Scott have had backgrounds in medicine, both have embraced participation in research, with Scott ultimately donating his brain to further our understanding of DLB and other dementia disorders. And Karen, would you also say a few more words about yourself and your background?
Yeah, sure. Hi, everybody. Thank you so much for having your interest in a panel of caregivers. Yeah, my husband, Scott, was an anesthesiologist, had to abruptly retire when some nurses noticed that he was missing some things. Thank goodness nobody was hurt. But it was a sort of shocking moment. And it took several years for us to find the right neurologist to get the presumptive Lewy body diagnosis. He died in April after 8 years of suffering, I'll say, with this disease, and we're still waiting for the results. So I always say everything's always presumptive in terms of the Lewy body diagnosis. We'll find out more early next spring, hopefully. But we were both, he was a medical doctor, I'm a doctoral prepared nurse, and are both really dedicated to research. And so we put ourselves forward searching for all kinds of research studies to advance the science. Particularly around Lewy body, which doesn't get as much attention, as you know, as Parkinson's and Alzheimer's. And so we probably participated in a dozen pretty substantive studies. And it was becoming kind of a full-time part of my caregiving, but something that felt productive, as opposed to the caregiving where you're doing more and more as the person is able to do less and less, and it can be kind of depressing. not kind of, it is depressing, but participating in the research studies made us feel like there was some value to this awful journey.
Thank you, Karen, for those words, and we will kind of dive into what motivates you guys for research in a minute. And no, oh yeah, sorry, no, I haven't forgotten. Sorry. But last but not least, we have Claire Pensyl, and she has had a remarkable caregiving journey, and that was brought to our attention by Dr. Joy Fleischer of Rush University Medical Center. And Claire has served as the life and care partner to her husband, Ira, who lived with Parkinson's disease for many years prior to his passing. And as I understand, through her and Ira's participation in research, Claire became really passionate about caregiver peer mentoring and has co-authored a publication on family caregiver contributions in Lewy body dementia. She's been a really significant advocate. And so, Claire, would you mind saying a few more words about yourself and your background?
Sure, thank you for having me. I was wife and caregiver for my husband, Ira Bell, and I also called him my facilitator, his facilitator. He had congenital orthopedic issues and 4 chronic diseases, including Parkinson's disease with Parkinson's disease dementia. He was never diagnosed with Lewy body. From 2016 till his death in 2021, he was in stage 4 or 5 of Parkinson's disease, could barely stand by himself, and certainly couldn't walk without some form of assistance. Nevertheless, he was insistent on fighting the decline and would do anything that anyone suggested. So we did massive amounts of PT, OT, and speech. We did exercise classes, dance classes, speech classes, improv classes, and adaptive sailing classes.
Right.
As part of that, we also participated, we worked with 3 separate research teams that were doing research in Parkinson's. None of it was necessarily Lewy body related, but we worked with all 3 teams so closely that I can't really say how many clinical trials we participated in, because it was sort of like, if anybody asked, we responded. I think we probably did 8 clinical trials, and we were also very active in Fox Insight and PPMI. And I am still reaping the benefits of working with Dr. Fleischer, and that's why I'm here.
That's very amazing. All of you have really amazing stories and clearly have gone through a lot with these difficult diseases. We have basically a room full of researchers here. And so we hear you when you say these studies are, it's very time consuming, a lot of things to do as part of these studies that you're participating in. And I guess one of our first questions is, were there any aspects of certain studies that you maybe participated in that really inspired you to join, like about the particular study itself, or kind of just the overall drive for advancement in the disease? And then maybe were there certain aspects of studies that discouraged you from joining? I don't know if anybody wants to start off and just maybe comment on that, like particular aspects of studies that were inspiring or discouraging.
Well, I'll start and say, in our existence, getting daily exercise was the critical component. So, and that was sufficiently convoluted that it had to be something that we were really committed to be able to find the time to participate in a clinical trial. So from a pure practical aspect, Dr. Fleischer's trial came to us, and the other 2 teams that we worked with were at Northwestern University, which is a half a mile away from us. Made an enormous difference in what we could do.
Yeah, either Christy or Karen, do you have an, I know
Go ahead,
Christy, we had just approached you for one that involved a lumbar puncture, and we kind of decided we would just hold off, right? But can you talk about maybe your experience, what chose, what drove you to choose certain studies, and maybe what discouraged you?
I think, being the primary caregiver or decision maker for my father, we, as Dr. Higginbotham or even Emory approaches us on different studies, I take a look at what the impact is, involvement specifically on my father's part, but also knowing that this is going to enhance the research down the line, and anything that, I keep telling myself, anything that we can do or what we've experienced can help future family members or future patients or doctors, we're all for it, just because there's so much unknown about this particular disease.
And for myself, one thing that I was interested in, and Scott in the beginning, when he could still participate in the decision making, was in the research studies. You get tests and procedures done that you don't get clinically. And so I was interested in as much information as we could get. And a lot of studies are paid for by Medicare if it's an Alzheimer's diagnosis, but not for Lewy body. And so it's sort of a selfish reason, but it's one of the reasons I was interested in some of these tests, because Scott would get access to some imaging and some other kinds of tests, like the smell test, that we weren't getting in the clinical setting. And, being a nurse, I was delving into the literature all the time and like, hey, they're doing this in Australia. It's like, oh yeah, we don't have that here. We don't pay for that. But sometimes it's included in a study. So I was sort of kitchen sinking the whole caregiver approach. And so accessing research was a way to just get more attention to my particular husband's brain and what was happening to him.
Very nice. I think that often comes up when we're pitching or trying to talk about research studies, is, what kind of results you get, like what kind of things will you learn personally about your own journey or your participant's journey. And it sounds like, Karen, you actually said that, some of these actually, you have these tests and you're learning from these results. Did you actually get kind of feedback or reports or things like that helped you, like navigate the disease?
Sarah and her predecessor worked closely with where our neurologist was at Harborview, Memory and Brain Wellness Center at Harborview. And so we were able to access a lot of the results from various things, which the neurologist at Harborview, obviously there's no treatment or anything for the disease, but he's also a researcher and interested in just everything that there is to dig up and know. And actually, sometimes the studies changed the way I was able to view Scott's capabilities. For example, the smell test, which was those cards, and there were like, 40 or 50 smells, and I would scratch it because Scott at that point couldn't understand how to scratch it and sniff it. So I was scratching and I'd sniff first and then he would sniff, and I got to just watch him like not be able to identify a smell, even some of his favorite smells like cinnamon and lemon and so forth. And so that was fascinating to me. And also when we got to the one where it was natural gas and he couldn't identify it, he said it was, cedar or something. And I realized, I've been leaving him home alone. I'm a nurse midwife and I would work these 24-hour shifts in the early years of dementia. And I realized I shouldn't be leaving him home alone at night because he doesn't understand what the smell of natural gas is. And so little insights like that, that we only got through participating in research for me to sort of see his dementia with different eyes.
Yeah, that's great. Anybody else have insights or things that you've learned that were particularly striking to you in these studies that helped you navigate or the disease or caregiving?
Well, my perspective is a little bit different. One of the most valuable things that I got was a mentor who was paired with me for 12 weeks during Dr. Flesher's trial, and is someone I still talk to and can reach out to in moments of angst. And one of the other research teams that we worked with was focusing on language retention in neurodegenerative diseases, and taught us that I've got fairly substantial hearing loss, and they taught us worlds of things. They basically said that it was a train wreck for someone with PD to pair it with someone with hearing loss, and gave us an enormous amount of advice. Like, don't go to Costco for your hearing aids, take Ira to every appointment. So that was just invaluable.
What would, obviously you guys are all amazing, very dedicated. What would help us, recruit more patients and participants in DLB? Maybe patients or participants who are not as involved. Like, what could we do as researchers to help that you think would help, like the research effort, getting it out there, or at least making it more appealing to patients? You have thoughts on that, or maybe just some experiences that worked for you or inspired you with your individual mentors or research experience?
Well, one thing that Scott liked was Sarah and everybody at the VA was so kind and pleasant and did everything they could to make him feel welcome and not judged. And so when it was time to go to the VA, or of course we ended up in the middle of COVID, so we did a lot of the stuff on Zoom, he was happy and excited to go. And so it was an outing that we could do. And we were going to a place where I, as the caregiver, didn't have to sort of like protect him from stigma and protect him from people not understanding what the heck's going on with him and so forth. It was just a safe place to go that other than doing the neuropsych tests, which he hated because he still had self-awareness almost until the end, because he knew he was doing poorly on them and it was embarrassing for him. But other than that, he really liked going there. We would take the light rail train and walk to the VA and pick blackberries and just make it a whole day. And yeah, it was a pleasant, attractive experience for him, and then therefore for me.
Good.
I think,
go ahead.
I was going to say, I think for myself, it's more communication. I mean, I think, Emory has, Dr. Higginbotham has reached out on studies, but I think if there's more communication, emails, that there are other studies out there, or you need involvement. I mean, my father's only participated in a small amount, and possibly, we've had to change things, but, communication, because I think the only way everybody's going to learn is having folks participate in studies. And if we don't know there's studies out there, we don't know what we don't know, right?
Yeah. And I know, Chrissy, you've been involved in some support groups too. Would it help, like, reaching out specifically there, or have you learned about research through those groups? Or
well, yeah, not totally. I've now started doing a lot more with the LBDA organization, so I've got to do a little bit more research on their website and stuff to see what kind of studies they do. But I think it's just understanding what's all out there to participate in. I mean, you provided me with a support group when we first met there within Emory, and I went to do that for, I think I was there for maybe 2 or 3 sessions, so it maybe lasted 3 months, and it was great listening to other folks' experiences, and it helped me learn more things. But I think I also need to take a more active role in finding more research studies out there to see if they're doable for my father, just so we can learn more.
I think there are a couple of things. One is that I agree with Karen. Ira loved doing clinical trials, loved the teams he was working with, was just energized by being around young people who were pleased to see him. And you know, he was always happy to see them. They were always happy to see him. With one of the teams, the last trial he was in, there were 8 or 10 people standing around while he did a mini mocha, but they were all cheering for him. So I don't think people understand that you don't, there's not enough flesh and blood in the descriptions of clinical trials. And then the other aspect is, from the caregiver standpoint, you know, how long does it take to get there? What's the parking? What's the ramp situation? Is there a family bathroom if you're at the stage that you need that? All of that is just stuff that if you have that information available, it's easier to say, oh yeah, we can do this.
It's a very good point. Logistics, that definitely comes up several times. It'd be nice to have just it printed out for you, right? Or at least right there, information at your fingertips so you know exactly what you need to do. That's a very good point. And also more cheerleaders during neuropsych testing is what we learned actually too. So that's amazing. I think, do we have time for some questions? Okay, from the audience?
Yeah, do we have any questions from the audience?
Hi, Michael Schwarzschild from Boston, Mass General. Thank you all for you and your parent partners' contributions. You mentioned a fair amount about how generous you were and how important it was to be engaged in the research, and even you, Karen, I think about getting information back. And so you were talking about tests that were part of this study that were standard tests. But one thing we hear a lot, and we try to improve, but I don't know if it's working, I'd be interested in your experience, is hearing about the results of the research itself. Because it takes, that can be, first of all, years after you finish the study, but it's considered, I hear, very important. I understand. I just wonder what your experiences were in the many studies that you did, and if you think that's gotten better or still needs to improve.
Still need to improve. I go in PubMed and sort of search around and see, oh, I think we were part of this study. And sometimes I'm not sure. And then I can see kind of where it was conducted. And yeah, we were in studies also not at the VA, some other different ones. And yeah, I have to search myself. And I know how to search in academic libraries. But to be included on a mailing list, which I guess you could get off of if you wanted to, and maybe after the person dies and you move on with your life, you're not as interested, but I would definitely like to see that Scott's participation in research actually ended up in a publishable paper, whether the results were, something that changed the trajectory or not. We also learned from finding that there's, the p-value is greater than 0.5 or 0.05, sorry. And, so yes, if there was a way to keep the communication going and having the studies forwarded and not having to pay $70 to get the actual printout from Elsevier or whatever.
I would also like more feedback in that regard, but I'm also with another practical, since the person in the trial is your patient. When that person dies, you often lose track of the caregiver. And so the caregiver caregiver can move or change an email address or whatever, and you're never gonna be able to contact them again.
Thanks. Something to improve.
Thank you.
Kumar Narayanan from the University of Iowa. First of all, thank you for all that you've done in participating in this effort. I was wondering if you feel organized, if there are resources for caregivers. Do you feel connected to caregivers across the country, or do you feel isolated?
I think there's a lot of caregiving services and groups out there. It's just digging and then staying constant with it. There are days I feel isolated, and I live in Atlanta, and you would think that there'd be several, but it ebbs and flows. And it's also how willing are you to participate in those caregiving groups outside of, you know, doing a job if you're still working and then taking care of that person. So it's a lot of digging for support groups.
I agree. It's super isolating. And I think the three of us on this panel are probably chosen for this panel because we're seen as go-getters and willing to speak publicly and be out there. But a lot of the people I encounter are just doing this alone, and they're sinking. And it's pretty awful. And I was in one study for Lewy body caregivers through the University of Washington School of Nursing. And I met some incredible people there. And we just continued on with our own informal support groups after that. But especially for older people who, I mean, you can find some community on Facebook or whatever. I'm not a big Facebooker, but the only thing I do on Facebook is a Lewy body caregivers group. But a lot of people are not, again, we suffer from stigma, we suffer from embarrassment, we suffer from judgment that we're not very good caregivers because things are always going sideways all the time. And so there's a lot of progressive isolation that I would love to see primary care providers, neurology clinics, and maybe even researchers really reaching out and trying to help caregivers network.
Well, I think I calculated at some point that I was in and out of 10 different support groups over the course of 6 years. And started to look at support groups as where I went to find support, and then I didn't need the support group. And I do have a great network from people who still call me twice a day to make sure I'm fine, to a group of women in California that I Zoom with once a month because we also broke off from another support group. But I think it also speaks to is support group more productive than mentoring? Because I really think that particularly when you're really in the weeds with these diseases, you don't need to be in a support group with someone who's just gotten a diagnosis.
Yes, yes. Yeah, the stage of the disease is really important. People who are early, who get paired with people who are in late disease, get scared and run away because they don't want to hear about diapers and wheelchairs and stuff. And people who are in late disease we can be mentors to people in early, but we need to talk about our own stuff. That's really different.
Yes.
Hi, my name is Diane Stevenson. I cannot thank you enough for being brave to come here to talk to all of us today. My unique story, so I lead a worldwide consortium coalition on Parkinson's, and now we're open and wanting to do more in DLB as well. But my personal journey is I lost my brother to what was diagnosed as PDD, but I am almost certain he had DLB. Listening to your stories, my sense of helplessness as his sister was not being able to convince my family to have my brother go and research, because I know for 30 years what his contributions could make. So I want to thank you for your leadership in helping advance the field. Your experiences are so critical for everyone to learn from. But the question I have for one of you is that, it's so important that you shared how active you were to have your spouse exercise and do all the things, dance, that we are told that are helpful. Do you think in your experience that that was helpful in your journey with your spouse? And how can we help spread that news? Because I feel like there's too many people in isolation that are not getting even a sense of hope from even those experiences while we wait for therapies that are going to help delay and halt progression. So I think my question is for the person who said that they were so active in helping support their loved one. How is that seen for you now in terms of would that be something to pass on?
I think it made an enormous difference in both of our lives, because it did get us out. It did get us about. The classes that were absolutely the best were ones where caregivers and one participated, because the caregivers were the social network. They were the people who would work the room and say hello to everybody. And you know, I had one group that, you know, we did potlucks like once a month. And it was a great social organization. And the other thing is that if you're in an in-person situation, you can look to the right and see people who are in better shape than you, and look to the left and see people who are in worse shape than you. And it just gives you a sense of perspective, no matter, you know, how far you are into the disease.
Yeah, for Scott and me, Scott was a super athlete exerciser anyway, so that was natural for him. And it also, because until the last 4 months, his body worked perfectly. He died when he was 71, and he was in perfect athletic shape and had no diseases other than the DLB. And so that was one thing he could still do with some of his friends to keep him social and to give him that sense of dignity of still being connected to his old life. And that was super important. So for the socialization, the exercise, and then also the sleep, obviously he had the REM sleep disorder. And so we were constantly working on good sleep. And being a midwife and anesthesiologist, we prioritize sleep over everything anyway. And so working on sleep was good for us. And then also as an advocate now for preserving our brains for our aging years, I'm able to use the research that I've learned about lifestyle stuff to talk to my friends who are in their 60s and 70s and 80s. But one thing I think I haven't been impressed with the research is the use of supplements and diet. So I've created a team that was Scott's primary care provider, who's internal medicine and functional medicine. We had our team at Memory and Brain Wellness at Harborview, and our research team at VA. And he also had 3 different naturopathic physicians who were working on different things. We did treatment for chronic Lyme and so forth. Like I said, I kitchen sink this thing. And Scott was on a lot of supplements, which if you go into the research for neurologists who've left standard neurology field and have gone into this sort of, you know, functional integrative medicine thing, they've got a whole different slew of research than you guys look at. And so I felt like I was navigating 2 different cultures around dementia. And in none of the research studies were they interested in the supplements that he was on or the diet that we were doing, which I saw the diet make a huge change in his brain 2 months after we started it. And we continued on it for 5 years. But I was always told, oh, that's not research-based. It's not research-based. And I'd say, well, hand washing wasn't research-based until it was. And, you know, grapefruit juice wasn't recognized as a problem until it was. And so, you know, why not try it? I saw N=1 in my husband, the diet make a difference. And when we would get sloppy and go off it, I would watch the inflammation in his brain kick up again. And so we'd go strict back on the diet. I say we, because I did the same diet with him so that he wouldn't feel like he was isolated from the rest of the way the world eats. But at any rate, so I don't know, I think each side having interest in each other's worlds would potentially be hypothesis generating for the people in this room. If you collected information that people, all the research studies we did, they were only interested in the allopathic medications he was on. They weren't interested in the herbs and the mushroom thing and all this other stuff we were trying. And who knows if it does anything, we don't know. But it'd be great just to gather the data, and then you've got that in the data set to maybe in 5 or 10 or 20 years when you got a postdoc who's looking at something, then at least that data has been collected.
Well, these have been all
somebody asked about the diet. Sorry, on the chat. Yeah, we did the Bredesen diet. We found a naturopath to walk through the whole protocol with us. We started in 2018, and he was 100% on the Bredesen diet for 5 years until he went into memory care, and then he was on institutional food, and then that was a whole nother thing.
Well, thank you so much for all of these insights. I know I've learned quite a bit, and I think everybody here is, as we said, we're just really, really privileged to get to hear, like, you guys unfiltered tell us your experience in research and caregiving. And so we just want to thank you for being here and dedicating your time.